Hi everybody, I'm Dr. Duc Vuong. I'm a world famous bariatric surgeon. I'm the author of 13 books, and I've trained other surgeons and I've helped thousands of people, and it is my mission to help as many people as I can. And while I wish I was doing a Facebook Live or teaching a class on how to cook or eat healthy, unfortunately these times it became really apparent to me on March 12th that I talk about coronavirus. Why? Because on March 11th, the World Health Organization declared it a pandemic. And on March 11th, if you look back at the data, the United States only had only 1,600 cases. 1,600 cases and about 25 deaths. Well, today, sadly, today is March 20th, and we are over 16,500 cases. I did not predict that we would hit 16,000 until Sunday, the 22nd. So we are 2 days ahead of schedule. This is based on what's called the R0, the reproductivity, the doubling time of the virus, which is usually 4 days, which looks like it's about 3.5 days, 3 days, because testing is getting more prevalent. So we're testing people more and more and more. So my friends and call why should you listen to me? Why should you listen to me and not CNN or as opposed to ABC or your regular news, whatever, right? Well, it's because I have colleagues who are surgeons and doctors in other parts of the world. Italian colleagues, Iranian colleagues, which is the third most affected country, Chinese colleagues, and a lot of people are wrongfully blaming this on the Chinese. And so I really know what's happening. And so what happened on March 11th, I started paying attention. I was like, oh my gosh, the World Health Organization is declaring this an emergency, a pandemic. Like, when has that happened last? And we have cases here in the United States, so I started paying attention. And the numbers are really horrific. So I thought we wouldn't hit, if you go back and watch my videos from a couple days ago, I thought we would be around 12 to 14,000 on Sunday, March 22nd. We are at 16,500 in the United States alone now on March 20th. And I want to do some math, and I want to tell you the timeline of this coronavirus and why your life is going to be affected for much, much, much longer, right? So much longer. So please hit share. Please tell your friends and family that this is really serious. I mean, we are in the middle of spring break right now, and kids are taking it like it's not serious. They're on the beaches, they're partying, they're in Florida, they're having a good time. Like, God bless them. I was a college student one time too, but I'm telling you, this is major, major, major problem. This is very, very serious, okay? And so let me give you some numbers really quickly, and then I'm going to give you the timeline, all right? So worldwide, we're around 255,000 cases, and we're at 10,500 deaths. So 10,000 deaths, we are more an average entire worldwide flu season is about 10,000 deaths. So for all your friends who sit there and this is just the flu has killed more people every year, what's the big deal? Dude, pay attention now. In 1 month's time, please hit share. In 1 month's time, we have surpassed the typical number for deaths for the typical flu, the seasonal flu. We've already surpassed it. We are going to blow that number out of the water. It's terrible. 10,500 deaths worldwide. In the United States, we have over 200 deaths now. And remember, this is going to double. All these numbers are going to double. At first we thought every 4 days. I think it's going to be every 3.5 days, right? So, and I want to explain this to you. So here, right now, let me tell you what's going to happen with the coronavirus, okay? I just took a shower. Okay, first of all, I have allergies, so I can touch my nose. So anyone who's touching, you can touch your face, it's okay. I just got out of the shower, so there's no coronavirus on my hands. I can touch my hands, I can touch my face all I want. It's okay. So that's one of the misnomers, the false things about this whole disease. Yes, you should avoid touching your nose if you're out in public, right? But I'm here at home. So you'll see me doing that because it's allergy season right now, and Houston is like just full of pollen. All right, so let me tell you about this timeline. And this is super important. Number one, we will not hit peak season for coronavirus. We will not peak in the United States until mid-May. We are predicted mid-May. Chalk that one up. Think about that. Now, peak. What does peak mean, Dr. Vuong? Like a peak. It's the top, right? So you're going to peak into mid-May. That's the highest number of cases, we think. Even with all the measures and the controls. So everything we've done will not change this timeline. It will just only decrease the number, right? So let's say the peak is way up here. If we did nothing, the peak would be way the fuck up here. But since we're doing something, hopefully, because we canceled the basketball season, we canceled concerts, maybe the peak will be down here, the top. The number of cases will be down here. But we'll still have a peak. And that peak, we are suspecting to be around mid-May. So you are going to be in this until like August. But Dr. Vuong, you just said mid-May. Why now you're saying August? Well, you know, pay attention, because the peak is mid-May, right? The top. But that means let's just make up a date, right? So March 15th or May 15th. May 15th is the peak. We'll make that up. Well, there are still cases May 16th, May 17th. The cases don't go away. Peak just means the highest point. I know y'all are understanding that. But this concept of like there are still cases. The number of cases will decrease, but it won't be as fast as you think, right? So May 15th, and I'm making up a number. Don't hold me to this date, but mid-May sometime is the peak. So, and I'll make up a number. Maybe that day we have 100,000 cases on one day. One day, 100,000 cases, guys. Terrifying. Well, that means May 16th, we still have 95,000 new cases. New, not old, not currently treated. This is where the mind fuck comes in. Okay, this is where you get messed up. If you don't like my cursing, don't share it. No, if you don't like my cursing, please share it. You need to share this because this is really important. So think about this in your head just really quickly. May 15th is the peak. We have 100,000. I'm making up those numbers and dates. Roughly mid-May. You have 100,000 cases. So that means May 16th, you have 99,000 new cases, more on top. May 17th, you have 98,000 new cases on top of the 99,000 you already had. May 18th, you've got 97,000 on top of, and I'm only decreasing it by 1,000. I don't really know what the real number is. My point is it's going to be a slope. It's going to be up, peak in mid-May, and down. So you will still have a huge chunk of number of cases. So you're not really... I mean, the numbers won't decrease until probably mid-June, July. Seriously, July, where the cases are back down to these numbers a week ago, guys. Listen to me. A week ago, like New York State had 500 cases. And now there's 7,000 cases a week later. Think about that. That's the state of New York. So let's do this math. So what's going to happen? The virus is going to peak in May. Here's a timeline, and I'll make an infographic for it, right? And I would love it if you guys shared it for me. I'm going to make a timeline infographic, and hopefully you guys will share it for me. Mid-May is going to peak in mid-May. You're still going to have a huge number of cases through the end of May. June, July, you'll start burying your loved ones. You're going to start burying your loved ones in July. The death toll will increase. Dr. Vuong, you said it peaks in May. Why are we burying people in July? Well, remember, because it still has all those huge numbers going down, right? So if it's 100,000, 99, 98, 97, 96 every single day, but it's going down, it's trending down. Now, it might trend down exponentially. It might go from 100,000 to 90,000 to 80,000 to 65,000 and will be gone. But you still have that whole huge thing of cases. And I'm making up those numbers, but we know that. But the timeline will not change. And this video is about the timeline, right? Okay. So now, what's going to happen? Now, if you watch my previous videos, and I'll repeat this video on Sunday, and I hope you'll share it, but it's basically how you die from coronavirus. It's not the flu. People think you die because of the flu. You don't. You have flu-like symptoms, and most of people, 80% of people, will have just typical flu-like symptoms and recover. That's fine. But 3% of them are going to die. And how do you die? You die through pneumonia. You die through pneumonia that escalates into something called ARDS, acute respiratory distress syndrome. And how do you treat ARDS? Pay attention now. How do you treat ARDS? The doctors put you on a ventilator, a breathing machine, a breathing machine, right? Like what you see with a breathing tube. And I'm sure all of you have had friends or family that you've seen at some point on a breathing machine. Okay, so now the average time span spent on a breathing machine for someone trying to get over ARDS, whether it's caused by SARS or MERS, Middle East Respiratory Syndrome, right? Whatever the cause is, the average time span is 2 weeks. Dude, 2 weeks. So you're going to have this huge number of cases. 10% of them are going to need hospitalization. Half of those people are going to need ICU care. Half of those people are going to need a ventilator. And we don't have enough ventilators, guys. We don't have enough ventilators. So the people, this is mid-May. All right, stay with me here. Mid-May, we are going to be out of ventilators. We are going to ship ventilators to high impacted places like New York City, Los Angeles, Houston, Washington State, Seattle, things like that. We're going to ship ventilators to there. We're going to try to make more. They're doing all that stuff. We're already running out of PPE, personal protection equipment. We've talked about that. So mid-May, now these people are going to be on the respirator for 2 weeks. This is kind of gruesome, so you might want to put the kids out of the room or mute it or something. But you definitely want to hit share because I'm going to tell you what happens. Here's what your doctor is going to tell you, right? When your coronavirus goes from the flu-like symptoms to shortness of breath, like I can't breathe, like I can't go up my flight of stairs, Dr. Vuong, and you're going to get a phone call from your mother who says, baby, I'm having trouble walking to my bathroom. I'm having trouble breathing, shortness of breath, right? You're going to go to the hospital and they're going to say, oh my God, like you tested positive. But because by that point, we'll have a very rapid, maybe 24-hour test, right? Right now, the COVID-19 test is 3 to 4 days. Okay, so you're gonna have trouble breathing, right? And then the doctor's gonna see you, and he's gonna admit you to the hospital, and he's gonna say, okay, I know you're having trouble breathing, but we have this huge other cluster, like this huge. Our hospital's full. We have all these people that are already in trouble. So I know you're struggling, but we're just gonna watch you. Now, what do? They're gonna put you in. They're gonna start an IV. They're going to give you supplemental oxygen, right? Because it's a lung disease. You're breathing. They're going to start you on steroids because that seems to be the best treatment so far is methylprednisolone. This is IV steroids. This is not what you take by a pill. Like if you have an arthritis flare-up or you've been stung by a bee. It's the same group of medicines, but this is not something. Don't call your doctor's office saying, hey, I need some of the steroids for this coronavirus. No. This is only when you've gotten really sick. And at this point, there's no treatment, and there won't be. I promise you, there will not be a treatment for this coronavirus pneumonia. The only treatment is what's called supportive, which means we help you get through this phase, all right? So pay attention now. This is what your doctor is going to tell you. They're going to say, Miss Jones, Mary, Miss Johnson, you're having trouble breathing. And by this point, grandmother is breathing, gasping. And I've taken care of hundreds of patients like this, lots of patients like this. They're breathing. And then the doctor's going to say, Miss Jones, we're worried you're going to tire out. I know that sounds morbid, it's terrible, but your doctor's going to say, Miss Jones, I'm worried you're going to tire out. We need to put a breathing tube in your throat, and we need to rest your lungs. So that's what being put on a respirator means. They are going to medically induce you in a coma, and they say that by saying, we're going to make you feel comfortable. We're going to make you, the breathing tube, you'll feel it, but we're going to make you feel comfortable. That means they're going to knock you out. They're going to put you on this respirator, and you're going to be on that respirator as an average of 2 weeks, okay? Now, here's the problem. We're fine now, but remember, the coronavirus is an add-on. It's a +1. You still have traumas. You still have car wrecks. You still have gunshots. You still have cancer patients. You still have low blood sugar, diabetics. You still have follow-up care. You still have the, oops, I fell and I cut my hand, right? You still have the normal, everyday medical issues, but now you have this huge pandemic. It's going to overwhelm our system. And we are seeing that because we're already starting to run out of personal protection equipment, gloves and gowns, and we're running out of a few medicines. This is important. Y'all pay attention, right? So what's going to happen is it's going to get to a point, because this has already happened in Italy, where they cannot put everybody on a respirator because the respirator is full. Now listen, normally, in order to be on a respirator, you need to be in the ICU, the intensive care unit, guys. Normally you have to be in an intensive care unit. Guess what? Italy has turned their waiting rooms into ICUs. Italy has taken their waiting rooms and is using it as patient care rooms. They are packing people into every space. So this whole American notion or Western notion about I need a private room, people get so bothered when you have a roommate in a hospital room. It's not a private room. People get so bothered. I'm telling y'all, people are gonna be lined in beds, in gurney. We're gonna run out of hospital beds. So you're gonna be on a very uncomfortable gurney in the hallway. That's where we're headed. And you're not that serious. I mean, you're sick, but you're stable. And you're on a hospital gurney bed in the hallway. And you're gonna be bugged and bothered. Let me tell you, this is a new world order. This is a new normal. This is a new extreme. I need y'all to help me. I need y'all to hit share because we are not anywhere near finishing this. So let me tell you, finish the timeline. The average duration on a ventilator is 2 weeks. Most deaths will occur between 1 to 2 weeks on the respirator. Either the patient will give out, or the patient's family don't want to see them like that and will pull the plug, right? But that means what? That respirator, I hate to use this term, but it's true, is tied up for 2 weeks. And every single fucking day, you're gonna have 100,000 new cases, and every single respirator is tied up. Why aren't you sharing this video? This is super important. You understand what I'm saying? You're having a new cases every single day, new cases. 10% of those cases need to be hospitalized, and you can't because you're going to be out of hospital beds, out of room, out of respirators, out of ventilators, right? You're going to be out of dialysis machines. So there's going to be some people who go from respiratory failure to multi-organ functional failure. So like their kidneys will shut down. Well, they'll need to be put on temporary dialysis. Well, we don't have that many dialysis machines, y'all. Plus, remember, this is a +1. So you already have patients who need dialysis. You already have patients who go to the dialysis centers every other day to get dialyzed. I mean, who's going to dialyze these people? You need to have techs and doctors and nephrologists to dialyze these patients. You need intensivists. Now you're going to start seeing they're calling in all sorts of people. You're going to start having gynecologists intubate you. And I'm telling you, I love my gynecologists, but they are not good at intubation. I'm a surgeon and I had to do some intubation. I did codes, whatever, so I'm pretty good at intubating patients. Psychiatrists, God bless them, I love my psychiatrists, but they are not good at intubation. It's a skill you have to do. But they're going to get called in to use their medical knowledge, if not to be the lead, but to at least fucking help out. Where everybody's going to be taxed. Timeline. So this is mid-May, guys. We are still 6 weeks away, mid-May. And people are not taking this seriously enough. Does that make sense what I'm saying? People are not taking this seriously enough. I am not a fearmonger. I don't care. I mean, if you think I'm a fake or a hoax or a fearmonger, I don't care. Hit share. Because guess what, fucker? I'm still going to have to take care of your mom or your dad when they come in. My colleagues are my nurses, my friends and family who are nurses and healthcare are going to have to still take care of your mom, your mom and dad, because you're arrogant, because you don't believe this is real, because you think this is media hype, because fuckface, you think this is something to get Donald Trump out of office. We are still going to have to take care of them. And you fuckers are stealing our masks and gowns? What's your problem? What's wrong with you? You don't have common decency, courtesy to leave toilet paper? Just take what you need? Why are you hoarding? Because I'm telling you, mid-May is going to be a huge cluster. It is going to call upon all of our resources as humans to come together, because by that point we will be in this for 6 weeks. And I promise you, anybody in mid-May who makes a peep about how this is a conspiracy, the Chinese are trying to, Bill Gates is trying to kill off the population, how people are trying to get Trump out of politics, any of these fuckers are going to be like you'll be scared to post on social media any of your stupid comments because of the hate, the anger that people are gonna give you because you are an idiot. I don't even know you, and I'm telling you, you're gonna be an idiot. It's so ludicrous. Now, why is this, Dr. Vuong? How do you know this is gonna happen? The answer is because we're falling in line with Italy. Outside of China, you cannot believe China. Do not trust anybody who posts anything from China because it's a government-controlled society. You don't know the real numbers. But we have access to Italy. I have Italian colleagues in Italy. I went to conferences in Italy. I have friends and loved ones, friends, colleagues from Italy. And they're telling me that it is a disaster. That patients are piled up in waiting rooms, that patients are intubated in the hallways instead of the ICU. And we are 2 weeks behind Italy. So what happens is we're in the medical field, we're using Italy, I'm left-handed, we're using Italy as the standard. So Italy's going like this. And every country except for 2 are falling in line with Italy. They're all joining this Italian curve, okay? The 2 exceptions, 1, Hong Kong. So anybody who posts, like my friends in Hong Kong say it's business as normal. Hong Kong, instituted testing early, made people stay home early, and believe it or not, those fuckers stayed home. And so their curve is very blunted. They are very low. Singapore is also lower than expected. Now, these are what we call the outliers. We don't care about outliers, maybe. And, we will study them and see what they did differently. But in terms of trying to predict the future, they're outliers, so you don't include them in the data. Now, what's the data? The data is the Italian data. Everything is going, what's happening with Italy. The number of cases, the death rate. So did you know that the death rate in Italy has 40,000 cases and more deaths, 3,500 deaths, more deaths than China. Italy has half the cases of China, a minuscule fraction of the population of China, and has more deaths, which calls into question, and the Italians are not stupid. They are well-trained doctors. Here, listen, you American arrogant people, listen. Italian hospitals have more hospital beds per capita than the United States. The Italians have more hospital beds than the United States, and they are stretched to the max. So it's per 1,000 people. So Italy, it has somewhere around 12 to 13, I don't remember the exact number, 12 to 13 hospital beds per 1,000 people. And then there's this huge list, French, German, Japanese, right? Huge list of countries. And way down in the bottom, the United States has 2.8 hospital beds per 1,000 people. 2.8 hospital beds. And Italy is there with 13 hospital beds per 1,000, and they cannot keep up. What does that tell you? All right? We are 2 weeks behind Italy, and we're on projection. We're following their curve. Now, I have bad news for y'all. Hit share right now, because this is bad news. As of yesterday, we have officially, in the United States, surpassed Italy in the sense that we are worse off than Italy. When you look at where we are today on the curve in the number of cases and death rate compared to Italy 2 weeks ago, we are worse. We are worse. Even though they canceled your basketball games, they canceled your hockey games, they canceled your cheerleading competition, even though they canceled your church masses, they canceled your concerts, they canceled your tours, they canceled, Coachella, they canceled all this stuff. Even though they canceled all that stuff, we are behind where Italy was 2 weeks ago. I thought we wouldn't hit 14,000 cases until Sunday, March 22nd. Sunday, March 22nd. I thought we would hit 14,000 cases. We are over 16,000 cases 2 days earlier than that. March 20th. Which means, let's do the math. Today's March 20th. We have 16,000 cases. I'll round it down to make the math easy. And it's looking like the number of cases is every 3 days, not every 4 days. And yes, I know that's due to more testing, that's due to more people taking it seriously. But you get the idea. This is the number of cases that's going to be reflected. So let's just do three days. Today's March 20th, we have 16,000 cases. March 23rd, which is Monday, if it doubles, we'll have 32,000 cases. This is United States alone. 32,000 cases in the United States alone. So that's the 23rd. The 26th, which is almost a week from today, right? So that's next Thursday. The 26th, we'll have 64,000 cases. The 29th, we will have 128,000 cases in the United States alone. 128,000 cases. And that means by the end of March, right, March 31st or so, we'll have 250,000 cases alone in the United States. Our death rate is lower than the projected 3%. Italy is really high. Italy is around 6% death rate, but let's say 3%. We're currently running around 1.72% death rate in the United States, but let's just do 2% because the math is easier. 250,000 cases with a 2% death rate. You just double that, right? Right? 5,000 deaths. Now, that's because you stopped. And he's like, Dr. Vuong, what's the big deal? That's because you stopped doing the math. So that's April Fool's Day. You're going to have 250,000 cases. April 4th, you'll have 500,000 cases. April 7th, you'll have 1 million cases. Now, if you go back to watch my videos, I said earlier that we were talking about 1 million cases at the end of April. Now we're talking 1 million cases April 7th, April 8th, somewhere around there. 1 million cases with a 2% death rate. It's 20,000 people. In the United States alone, I'm talking about the US. Worldwide, today, we have 250,000 cases today. And we have 10,000 deaths today. 10,500 deaths today. Which is the average. Dr. Vuong, it's just the flu. That's your average flu season, is 10,000 deaths. We have 250,000 cases today. So, in 3 days, by Monday, we're going to have 500,000 cases by Monday. A week from today, we're going to have 1 million cases worldwide. A week from today, 1 million cases with a 3% death rate is 30,000 people. Dr. Vuong, obesity kills more people. Oh, Dr. Vuong, tobacco kills more people. Fuckers, listen to me. It's been a month. It's been a month. A month ago, none of you guys knew what coronavirus was. You understand? Is this starting to sink in? It's only been a month. A month ago, Italy was walking around like no big deal. They were driving their Ferraris and wearing their leather shoes and their Prada dresses and looking fabulous a month ago. And now they're on lockdown and their hospital systems can't keep up. And more people have died than China. 3,500 people. They had 500 people die yesterday. What the fuck is wrong with people? Don't listen to Chinese data. You cannot trust them. I'm Asian. I get to say it. I get it. Some doctors can't say it because it's not politically correct. I'm telling you, don't trust the Chinese data. It's not a conspiracy. I'm not saying it's a government plot. I'm just saying don't trust their data. But believe our Italian friends. All right, the timeline. Back to the timeline. So we're going to peak in mid-May. And I don't know what that number is, but I just did, 250,000 for April Fools in the United States alone. So it's going to be a huge number if we don't get a hold of this by mid-May. Huge number by mid-May. And then remember, they're still going to, that's the peak. So the mid-May 16th, you still have, let's say, 100,000 cases in one day. 100,000 cases in one day. I'm making that up. In May 15th. May 16th, you still have 90,000 cases. May 17th, you still have new cases. Not the same cases. New. More cases. 90,000 more cases on May 16th. I'm making up these numbers. I don't know. 85,000 new cases on May 17th. It's going to overwhelm our system. So the timeline is this. You're going to start burying your loved ones in July. The death rate is going to peak in July because those people have been on the respirator, the ventilation machines, and we're not going to be able to put them on the ventilators because we'll be out of ventilators. We're going to be out of ventilators, and we won't be able. They're going to die because we don't have the resources. We don't have the manpower. We don't have enough hospital beds. We don't have enough doctors. I'm telling y'all, you guys are freaking out about coronavirus tests. You're not going to have enough tests. God bless President Trump for trying to promise Americans, if you want a coronavirus test, you can get it. It just won't happen. There are not enough tests and not enough people reading the tests who are able to read the tests. So All these people are going to die, start dying in hospital hallways. Listen to me, because you cannot be angry at your doctors who are trying their best, doing what they can, working with what they got. You cannot be angry at the nurses because she's out of meds, she's out of IV bags, she's out of respirators. You cannot take it out on your healthcare providers. The poor little, venipuncture girl who's just drawing your blood in the mornings. You cannot be mad at them. They're doing the best they can. And I get it. You love your mom, you love your grandmother, and she's in the fucking hallway. She's been in the fucking hallway for 12 hours. I get it. But that's where we're gonna be in mid-May, if not sooner. And then what's gonna happen? We're gonna bury people in July. The death rates are gonna peak in July, and then I don't know what to say after that. How are you gonna pay for them? You're gonna be out of work for the last 3 months. Your side hustle, maybe you're a vendor, maybe you sell at sporting events, maybe you're a waitress. My girlfriend's a waitress at a high-end steak restaurant. She is out of work. She does not get her money. What are you gonna do? How are you gonna pay for your mom's funeral, your dad's funeral, and you wouldn't fucking share this because I said the F word? What's wrong with you? You wouldn't wash your hands because you think you're young and healthy? What's wrong with you? What's wrong with you? What are you gonna tell your mom when she's in the hospital? Oh man, this skinny Asian surgeon, I thought he was just like a fearmonger. I thought he was just trying to get Facebook likes. But he predicted this 2 months ago. What are you gonna tell your mom? And your mom's gonna be like, dickhead? Shithead? I thought I raised you better than that. Why didn't you tell me about this coronavirus thing? Why didn't you wash your hands before you came over to see me? Why didn't you wash your hands when you came home? Well, Mom, he cusses, and I know how you don't like cuss words. It's a sin. And your mom's gonna be like, I did not raise shit for brains. Because those are the times we're in, guys. You have to put aside, and I get it. It's okay. I don't care if you don't cuss. I don't care if you believe in God. I don't care if you believe that this is a conspiracy. Share the video, because it's going to save a life. If you just wash your hands for 20 seconds, it will save a life. Don't let your little notions. This is the time to put aside whatever agenda, politics, beliefs you have. Don't compare this to fucking flu. Don't compare this to some stupid meme about drinking Boone's Hill or drinking out of a garden hose when you're a little kid. Don't compare this to religion. You can't fucking go to church anyway. Aren't you sinning right now because you can't go to church? Dr. Vuong, church is not the steeple, it's the people. Well, you can't congregate, yo. What about that? You can't get together with your congregation. Dr. Vuong, this is God's way of testing us. That's because you believe in God. Not everybody believes in God. But what I believe in is you're going to catch this virus. You're going to catch this virus because it's the novel coronavirus. It's a new coronavirus. This is worth sharing right now. Right now, hit share. Because no one is immune to this virus. Everybody is going to catch this. If you come in contact with this virus, 80% of you, yes, good for you. You just came down with the flu. You're going to be laid up in bed for 4 or 5 days, high fever, cough, aching, body aches, but you'll get over it. Dr. Vuong, what's the big deal? 97% of people recover. Yes! 3% die. 3% of a big number is huge. We are going to be lucky if we keep this under 100,000 deaths in the United States alone. 100,000 deaths in the United States alone, if y'all just do what we're telling you to do. We will be lucky. The fearmongers are saying 400,000 to 1 million. And I'm saying, let's not make them panic. Let's just call it 100,000. That should be enough to scare people. Because it could be your mom. All right, so 80% of people will just have flu-like symptoms, yes. But remember, you will pass this on to your susceptible mom, grandmother, aunt, uncle, who are diabetic, and you just didn't know it. You didn't know your uncle was diabetic, even though he has a big beer belly and has been smoking 2 packs of Camels for the last 30 years. And now he's in the hospital. I used to say, last week I said, and he was on a respirator. But now he's not even on a fucking respirator. Because we're out of respirators. We're out of breathing machines. We barely have enough nasal cannula for you to get oxygen. We actually don't even have oxygen. Every room, you have these little oxygen canisters that you dial out of the wall. What are you going to do when you're in the middle of the hallway? You're going to have portable oxygen canisters. And because you wouldn't wash your hands, because you don't think that this is real, that you think it's a hype, that you're pissed off that Coachella was canceled. Fuck you and Coachella. You're pissed off because your favorite bar closed, that your favorite restaurant is like delivery only. We're talking about your grandmother, yo. We're talking about your parents. We're talking about your loved ones. You need to get serious. I'm Dr. Duc Vuong. I'm the world's #1 weight loss surgeon. I've written 13 books. You can look me up. I have 400 YouTube videos. I've trained other surgeons. I retired at the age of 45 from surgery to help you guys. Because I didn't know why, but now I know. I have a bigger voice than your surgeon does. I can reach more people. I need your help though. I need you to share this video. I know some of you watching are my friends and my patients, and I need you to share this video. Because we are still at the panic stage where people are not taking this seriously enough. Too many kids are still out there on Padre Island partying, in Cancun partying, in Florida partying, at Miami Beach partying, and they should not be doing that. This is going to get worse before it gets better. These numbers are alarming me at amazing rates. Why should I listen to you? I don't know you. Because I have friends who are surgeons in Italy who are telling me this is terrible. Who are telling me they're out of equipment. I have friends in England who are preparing for the worst. I have predicted everything properly. You have canceled, listen, you guys, they have canceled your weight loss surgery. No one cares about your weight loss surgery. I love you, and I know my following's weight loss surgery patients, but they don't care about your weight loss surgery right now, yo. They know that this is coming. They are running out of beds. They can't keep up with the call volumes. They don't have enough appointments. We love you. We want you to be healthy. We know you want your weight loss surgery. We know that this is inconvenience. That was last week. Now we're talking about life or death. We want you to have your weight loss surgery. We want you to get healthy. But life threw us this curveball, and I need all of y'all to get on the same page with me. Put your selfishness aside. Just put your weight loss surgery questions aside for a little bit and share this video, and let's just focus on coronavirus. Let's get healthy. Let's eat healthy. Let's drink water. Some people are going to say, like, what do I need to do? Right? Do I need to go to the gym? Do I need to get in shape? No, gyms are closed because they're germ vectors. You need to eat healthy. You need to not go out. You need to drink a lot of water. You need to take your medicines. I'm talking to diabetic patients, high blood pressure patients. You need to take this seriously. You need to quarantine. You need to deliver foods to your parents and drop it off. People in my weight loss surgery challenge, I've been teaching them how to grow a garden, because you need to grow a garden right now. You need to grow spinach and lettuce. I know that sounds weird coming from a surgeon if you're new to me, but it's true. So did y'all get the timeline? You got it? Right? We peak in mid-May, which means we still have cases all the way through May. New cases, not old cases. They're not going away. New cases every single day. New cases. Peak in mid-May. New cases June, July, and then we start burying our loved ones in July. The death rate peaks in July, August, because those people will succumb. Those elderly, our loved ones. And, mark my words, we will be lucky if we are under 100,000 deaths in America alone. I will have felt like I did my job because we have 100,000 deaths or less in America alone. America alone. I love you guys. I'm Dr. Duc Vuong, world famous surgeon. You don't have to listen to me, but I recommend you do. I recommend you share it. And I never panic, and I never do videos like this, but we still have too many dickheads who are not taking this seriously enough. Don't be that dickhead. Don't be that person. I love you guys. I'll see you tomorrow for my update, and hopefully the numbers won't be terrible. So, worldwide, 500,000 cases by Monday is my prediction. By Monday. 500,000 cases by Monday. And a month ago, none of y'all knew what the coronavirus was. A month ago, guys. Last week, y'all didn't know. Last week, they canceled the NBA basketball season. Just think about that. Just think about that. Love you guys very much. See you next time. See you tomorrow. Bye.